Welcome back to our channel, where today we'll be discussing an important medical procedure known as cardiac ablation. Cardiac ablation is a technique used to treat irregular heart rhythms, also known as arrhythmias. We'll explore why it's done, how it's performed, and what to expect during and after the procedure. But first, let's delve into the basics. Cardiac ablation is a procedure that utilizes heat or cold energy to create tiny scars in the heart, which help block irregular electrical signals and restore a typical heartbeat. It's often used to correct heart rhythm problems, medically referred to as arrhythmias. The heart relies on a specific pathway for electrical signals to maintain a regular heartbeat. Any disruption in this pathway can lead to arrhythmias. Cardiac ablation may be recommended when medications have proven ineffective in treating arrhythmias. Serious side effects occur from medications used for arrhythmias. Specific arrhythmia types, like Wolff-Parkinson-White syndrome or supraventricular tachycardia, are present. Like any medical procedure, cardiac ablation comes with potential risks, which may include bleeding or infection at the catheter insertion site, blood vessel or heart valve damage, development of new or worsening arrhythmias, a slow heart rate that might require a pacemaker, blood clots in the legs or lungs, stroke or heart attack, kidney damage from contrast used during the procedure. In rare cases, death. Before undergoing cardiac ablation, your healthcare provider may order various tests to assess your heart condition. You'll typically be instructed to fast the night before the procedure, and your medication regimen will be adjusted as necessary. The procedure takes place in a hospital setting. You'll receive a sedative to help you relax, with the level of sedation varying depending on your specific arrhythmia and health conditions. You may be fully awake, lightly sedated, or under general anesthesia. During the procedure, catheters are inserted through blood vessels into your heart, often via the groin, shoulder, or neck. Contrast dye may be used to enhance X-ray images. Minor discomfort during catheter insertion and energy delivery is common, but any severe pain or shortness of breath should be reported to your healthcare provider immediately. Cardiac ablation typically lasts 3 to 6 hours, but the duration can vary based on your specific arrhythmia. After the procedure, you'll be monitored in a recovery area for a few hours. Depending on your condition, you may go home the same day or stay overnight. Arrange for someone to drive you home, and expect some soreness that usually resolves within a week. Most people can return to their daily activities within a few days, but heavy lifting should be avoided for about a week. The good news is that most people experience improvements in their quality of life after cardiac ablation. However, there's a possibility that the irregular heartbeat may return. If it does, the procedure may be repeated, or alternative treatments may be considered. Depending on your specific arrhythmia, you may still need to take heart medication even after cardiac ablation. Cardiac ablation is a vital procedure that helps restore normal heart rhythms for many individuals with arrhythmias. If you or someone you know is facing heart rhythm problems, make sure to consult with a healthcare provider to discuss whether cardiac ablation could be the right option. That's all for today's video. If you found this information helpful, don't forget to like, share, and subscribe to our channel for more informative content. As always, consult with your healthcare provider for personalized advice. Thanks for watching, and we'll see you in the next video.